Wellness Wednesday, and we got the one and only Dr. MJ Collier in the building to answer all of your medical questions. Dr. Collier, good morning. We are happy to have you.
Good morning, Rickey, Smiley. Rocky, Special K, here with the T, Alfredus, and the Brat. Thank you, Rickey, for the opportunity to bring healthcare information to the listeners of the Rickey Smiley Morning Show. How are you this morning?
Man, blessed and highly favored, man. Cold is gone. I fought it all, treated the symptoms, and I feel great.
Well, absolutely. That's what we want to hear, my friend. So, Rickey, our topic this morning is vasomotor symptoms or hot flashes in women. Yes, it's getting hot in here. Perimenopause is now recognized as a symptomatic time that's onset before actual menopause. Now, menopause is defined as a woman not having a menstrual cycle for at least 1 year. Now, for many years, and as long as I've been practicing medicine, Rickey, we have been told hot flashes were a temporary nuisance lasting no more than a few years. So they did a study. They just completed a study called the SWAN study, SWAN, study on women's health across the nation.
Finally.
This study included Asians, African Americans, Latino, and white women, which revised this understanding completely. The study tracked women across the menopausal transition from early to late menopause. The purpose was to study the duration of the symptoms, particularly hot flashes, and how long they actually last. And, Rickey, the results were amazing. In Asian women, the symptoms would last at least 5 years. In white women, the hot flashes persist for approximately 7 years. In Latino women, about 8 years, but in black women, 10 plus years. That is absolutely incredible. And one of the reasons that, you can have those symptoms for so long, it causes other problems. So there are clinical consequences that exceed well beyond just not feeling comfortable, just having problems with sweating and having difficulty sleeping. So severity and duration of vasomotor symptoms or hot flashes are independently associated with increased cardiovascular risk, heart attacks, strokes, and dementia. So we know that black women are predisposed to those disease states, again, due to the inflammation causing those symptoms. They disproportionately affect black women. So the menopausal transition for this population is just a brief inconvenience, but prolonged physiologic stress states with measurable downstream morbidity. That's not good. Various treatment options, of course, especially pharmaceuticals, react differently. Different medications react differently in different racial setups. So black women may respond to a medicine different than a white woman or an Asian woman. We have realized this. That's called pharmacokinetics. So there's a drug called Paxil that's actually for anxiety and depression. It's the only medication that's non-hormonal that was approved for vasomotor symptoms prior to that, but it demonstrated clearly that it worked differently in women across different genetic spectrums. So also other characteristics, women who smoke, women with comorbid diseases like diabetes and high blood pressure, women that were skinny or women that were obese. So you got different responses to that. So the traditional and the best therapy, of course, is hormonal replacement with estrogen. But women often cite breast cancer and other cancers as a deterrent. They don't want to take that risk, or they are susceptible to that because of their genetic structure, so they can't take estrogen. So they got two new drugs in this new class that will work with that specifically, and they respond and treat the symptoms of hot flashes and problems with sleep. So there we have it, Rickey. So this is affecting and always will affect any woman, as they age, they'll get to it. But it starts younger than we thought, and it lasts longer than we thought.
All right, let's go to the phones. You're on with Dr. MJ Collier. Good morning.
Hi, I was calling because the question I had is my grandmother is 80 years old, and she was diagnosed with IBD, which is inflammatory bowel disease. And at the age of 80, I was trying to see, is there anything that she can do far as like natural type remedies, because she is on a lot of different medications, and the symptoms that she's having is that she's losing a lot of weight.
She's having difficulty digesting her food and absorbing her calories because it's running right through her. Basically, a primary symptom is probably diarrhea. So with that diagnosis of irritable bowel syndrome or inflammatory bowel disease, there are newer treatments that are available. There are biologics that treat those symptoms. Every other commercial you watch, and if you're watching any of the basketball finals, is about these types of drugs. They are very effective, but at age 80, I would want to start with something natural as well. So the problem is inflammation of the colon and large intestines. I would start off with probiotics. Probiotics, God's gift to GI health that will calm down the inflammation. And also I would add an omega-3 oil, either vitamin D or flaxseed oil or even olive oil. Very good. A teaspoon of olive oil every day will help calm down that gut. So I would be, concerned about giving that kind of medication to an 80-year-old as well, because it lowers the immune system function. So it makes you more susceptible to diseases. And if she's already made it to 80, she's got other things that are, basically controlled, or she wouldn't be 80 years old. But, at that point, she's at high risk for pneumonia. I have had several patients pass recently from pneumonia that are in that age group. So it's out there, and it continues to be a risk factor. So natural things, omega-3 fish oil and probiotics will give her some GI benefit.
All right, real quick, you're on with Dr. Collier. Good morning.
Yes, I have a pain in my lower back, and I want to know what's going on with my lower back.
Okay, number one complaint of most people by the time they're in their fourth decade is low back pain. Number one complaint at doctor's offices for African-American women. You have what I call the black woman blessing. That's a prominent buttocks and thighs. And what that prominent buttock does is sway your back and put stress on your lower back. So you have to be very conscientious about doing range of motion exercises to keep that back straight. You need to sleep on your back with some support in your lumbar area. And it doesn't have to be anything more glorified than a towel folded in half and then rolled into a tube. You put that under your back and sleep on your back. If you sleep on your sides, the sides of your hips will rock and torque your lower back, causing stress. Then you go from one side to the other, seeking comfort, and you can't sleep, so you become chronically sleep deprived, which makes you ornery and angry, and then you got low back pain too. So that's just a hard situation to be in. But again, I call it the black woman's blessing, but hips and thighs.
So Dr. Collier, what about the pellets? What about because we were in here, the women were talking here. What
the pellet is the greatest treatment going. That is hormonal replacement therapy, and it is natural. And so women can get the pellet. I do the pellet here in my office, and it is amazingly enough, I have probably an equal number of men and women get it. Men get it for other reasons. Yes, but there are what I call, there's menopause for women, there's menopause for men. So men go through hormonal changes too. I was having hot flashes last night. I wasn't sure whether it was due to red wine or whether I'm just in the bed fanning. And I told my wife, I say, look, I can't sleep. I had to throw the cover off, so it can happen. It can happen. So yeah, but pelleting is something that I highly recommend. It's not as quiet as it has been. It was a well-kept secret. That technology has been around since the 60s, Brett.
Wow. But
we didn't hear about it. But with the onset of the internet and things like that, now people are learning about it, and the conversations being had in beauty shops, and women are talking to each other. Do you know about the pellet? The first time I had a patient that came to me with it, it was a man, and he was looking amazingly good. All right.
Hold that thought. More your questions and more your answers coming up with the one and only Dr. MJ Collier on the other side. It's Rickey Smiley Morning Show. Then we'll go straight to the call.
We were talking about bioidentical hormone replacement. Africa, go ahead.
No, we were talking about pellets and how to use them and how they work. Are they efficient?
They get put in your butt or something, right?
They get put in your butt above the sitting area. It's a minor surgical procedure. It takes about 15 minutes, and there's no recovery time. I mean, you lay on the table, I put them in, you get right up, and you go about your business. The only thing you can't do, it has a dressing on it that's like saran wrap, and it's water resistant, not waterproof. So you can take a shower, you can't take a bath, can't go in the ocean, can't go to the beach for a week. After that, you good. And this is the greatest therapy going. The therapy is actually called bioidentical hormone replacement therapy, but it's done with pellets. Each pellet about the size of a grain of rice. And I have put as few as one pellet in people. I have put as many as 14. It just depends on, what you need. And so it replaces whatever your neurohormonal needs are. And it's the fountain of youth. This is the greatest therapy going. And so everybody that knows about it wants it. Everybody's got it, don't want to ever come off of it. And you don't. Once you've been on it, you stay on it until you're 90 years old at the same dose. The dose never changes.
So I heard it's from a plant source. Is that true? Because that makes me want to do it because it's healthier, maybe.
Yes. but it's still estrogen. It can be estrogen. It doesn't have to be estrogen. It depends on what your needs are. But but the pellet is great. Highly recommended. I've gotten the pellets myself, and my wife has gotten them as well. Okay. And so it's the fountain of youth, no doubt. Every time people see me, they say, Dr. Kai, you aging backwards. I say, yeah, Benjamin Button. But that pellet, I have to give that pellet real credit for it.
I got a couple of pellets that'll get you into your 90s.
Mr. Smiley.
No.
Hey.
Excuse me. Broderick, calm down.
Hey.
Oh, got him. He got real quiet.
Let's go
ahead, Doc. Go ahead, Dr. Collier.
Yo, with Dr. Collier. Good morning.
So my son has severe eczema, and he has been on Dupixent and other shots. I just want to ask the doctor, what are some other options that are non-steroidal or either biologics that can help his skin?
Okay, there are some non-steroidal skin products that, because steroids can make black skin white, it can lighten it up, and you get, those patches with no pigmentation. And once that happens, it is incapable of being pigmented, so he always has those light spots. So that's why I don't like to use steroidal creams in African Americans. There are non-steroidal options, but again, the problem is usually from inside out. He needs to have blood allergy testing to see what he's allergic to. Oftentimes, it's a food product, but the blood allergy tests you for, grasses, pollen, trees, everything that's in the area that you live in. It also tests you for indoor allergies and outdoor allergies, everything from dogs and cats to milk and peanuts. So it is incredible how once you become aware of what that is, because it doesn't require you don't have to break out in hives or anything, but it just be causing an allergic reaction that makes your skin manifest itself as itchy eczema. So don't put Vaseline on it. That makes it look better, but it's really makes it more inflamed. Keep the skin well moisturized. Use some vitamin E as an Epsilon oil on it to keep it moisturized, and then a non-steroidal anti-inflammatory, and then probiotics. Probiotics I recommend under any circumstances. That helps so much with eczema symptoms.
All right, y'all, Dr. Collier, good morning.
Yes, my question is, how do I handle my sciatica issues after doing chiropractor and other methods? Is there any holistic alternatives?
Acupuncture works real good. There are some electrostimulations that can handle it as well. Maintaining a good body weight is key. For every 10 pounds you lose, you take 40 pounds of pressure off your lower back and knees. So very important that you in decent shape, and then range of motion exercises on a regular basis. I have found that exercises like yoga and Tai Chi can change your whole sciatica life, but sciatica and low back pain is chronic. It's a curse, and you need to do, those things that are necessary to keep your back as strong as possible. The last option is surgical. Most people don't benefit long-term from the surgery, and once you have had the surgery, now you're married to the doctor that did it, because nobody else will want to touch your back after it's been operated on by somebody else, so you don't want surgery. And they have found long-term studies that physical therapy gives a longer, better outcome under those circumstances.
Oh, that's good information, Dr. Collier. Let everybody know how you can be reached real quick.
Rickey, tonight, Facebook Live, Instagram Live. Go to Ask Dr. MJ on all social media and tune in, because tonight our special guest, Don Warner, Executive Director of MG Holistic Society, will be talking about autoimmune diseases and myasthenia gravis, lupus, Sjogren's syndrome, and all of those things that disproportionately affect African Americans. Log on to and subscribe to my YouTube channel, Ask Dr. MJ, tonight, 6:30 p.m. Eastern Standard Time. And go to my official website, lifebojobs.com, where you'll find information on various supplements. Follow me at Ask Dr. MJ on all social media platforms. And remember, these are the opinions of Dr. MJ Collier, not those of Rickey Smiley. The Rickey Smiley Morning Show cast or its production is true. Stay. Don't you dare go away. You're listening to Dr. MJ on the Rickey Smiley Morning Show.